Good evening and welcome to the special board meeting of the San Benito CISD Board of Trustees. Today is Monday, August 16th, 2021, and I call this meeting to order at 5:33. Roll call, Ramiro Moreno, present. Janie Lopez,
Present.
Oscar Medrano,
Present.
Rudy Corona,
Present.
Dr. Ariel Cruz,
Present.
Orlando Lopez,
Present.
Mario Silva,
Present.
Dr. Carmen,
Present.
Mr. Stephen Weller.
Present.
Thank you, sir. Next item on the agenda is public comment. Before we begin, I would remind our audience members of the board's procedures for handling public comment. The public comment portion of our meeting is available to members of the public who wish to address an agenda item to be considered by the board on tonight's agenda, or any item for that matter. Anyone who would like to speak during public comment must sign in prior to the start of the meeting and list the agenda item or the topic they want to discuss. Each public comment speaker will be allowed a maximum of 3 minutes to address the board for each topic. If more than 10 speakers are signed up to speak on the same agenda item, all additional speakers on that item shall be limited to 2 minutes. However, any public testimony speaker who requires a translator will receive up to 6 minutes to address the board. Please keep your comments or criticisms civil and courteous. Please avoid using profanity and refrain from making personal attacks on others during your opportunity to speak. Lastly, we ask that you do not discuss students who are not your own children. If a speaker is seeking board resolution of a specific complaint, that concern should be addressed through the district's grievance process. District policy DGBA has been established for addressing employee complaints. Policy FNG is the avenue for filing parent complaints, and policy GF addresses community member complaints. Grievance forms may be obtained at any campus administration office or at the district central administration offices. Thank you. Our first guest speaker is Mr. Jesus Montalvo. Mr. Montalvo? Thank you for being here tonight.
Thank you, sir. Thank you guys for giving me the opportunity to come and speak today on the agenda. I know that it's something that's been on everybody's minds. I am an organizer for La Unión del Pueblo Entero here in San Benito. We've been having a lot of calls and a lot of concerns regarding back to school, which started last week. I am a resident here, and I have 3 students in the school, one in elementary, one in middle school, and one in high school, representing all 3 grade levels. And today, my wife decided not to send my son to school because there was a outbreak. 5 students that came up positive from on the first day of school. And then on Friday, there was the big party at the Hacienda Apartments that there was just beyond capacity in the apartment, in the kitchen, and living room area. Nobody was wearing masks at this party. So my wife decided not to send them to school. I'm probably going to get in trouble for that. But we're here because we've seen in the recent weeks, Texas has been experiencing a devastating uptick in COVID-19 cases among young people. Pediatric ICU hospitalizations in Texas have reached their highest peak since the pandemic began 17 months ago, and many areas of the state are running out of pediatric bedding, ICU. Delta variant is currently ravaging Texas at twice the infectious rates as previous strains, including among children. And since children under the age of 12 are ineligible to receive the COVID vaccine, public schools are among the most vulnerable environments for viral transmission. Even vaccinated children and teachers can still contract COVID-19. While they may be protected against getting seriously ill, they can transmit the virus in those in their schools and bring it back home. Please require all students, teachers, administrators, visitors to wear masks in all your schools. It's the only way to keep our children safe as we confront this public health crisis. Because of this, the CDC, American Academic, and the American Academic Pediatrics recommended that all students, teachers, administrators, visitors wear masks in schools and other school buildings. So we ask to please consider this, and we know that there are individual rights that we have, that our wonderful country is known and is a beacon throughout the world to protect, but we also have to consider that anything that we consider an individual right that impedes on others' rights or health could be considered And we ask you in the community, and myself as being a community member and my children being at risk, to stand up, use our political power, which the census is showing we're growing, and stand up to any flagrant political ambitions or politicking that's going on in Austin, and do the best thing for our community here. Thank you.
Thank you so much, sir. We appreciate you being here. Next public comment, we have Mr. Adan Oseguera. Mr. Oseguera, welcome.
Hello, board president, superintendent. My name is Adan Oseguera. I'm employed with the school district, but I'm here on my own behalf. I'm going to read from a list that I printed out here. One second. Okay, Alamo Heights ISD, Aldine ISD, Austin ISD, Brownsville ISD, Carrollton Farmers Branch ISD, Cedar Hill ISD, Coppell ISD, Dallas ISD, Del Valle ISD, The Soto ISD, Donna ISD, Duncanville ISD, Eanes ISD, East Central ISD, Edgewood ISD, Edinburgh CISD, Fort Sam Houston ISD, Fort Worth ISD, Galveston ISD, Garland ISD, Grand Prairie ISD, Harlandale ISD, Highland Park ISD, Houston ISD, Huffman ISD, Idea Public Schools in Austin, Travis County, Irving ISD, Judson ISD, Lackland ISD, La Jolla ISD, Lancaster ISD, Manor ISD, Mesquite ISD, Northeast ISD, Pflugerville ISD, Far San Juan, Alamo ISD, Richardson ISD, San Antonio ISD, San Marcos CISD, Socorro ISD, South San Antonio ISD, Southside ISD, Southwest ISD, Spring ISD, United ISD, and I'm sure there's more. These are a list of school districts that are in some form implementing a mask requirement on campuses, and my hope is that this school board takes action. Our goal is to be the gold standard in all areas of education, and we take action and implement some form of mask requirement on our campuses as well. When parents leave their children on our campuses, we have the responsibility, and I'll repeat that, we have the responsibility to ensure that those students are learning in a safe environment. And I'm sure the board agrees there's no price tag on the safety of our students and our staff. Recently according to board docs, we spent almost $800,000 in the name of safety on our elementary school campuses. So any threat of litigation or anything like that, we should have that same mindset. No expenses spared in the name of our student safety. So I'm pleading with the board, pass a mask requirement today, help mitigate the situation, as masks are proven to mitigate. They're not foolproof, but they do help with mitigation along with all the other measures that SPCISD has taken in place. Like an umbrella doesn't keep you completely dry in the rain, a mask isn't 100%. So thank you for listening.
Thank you, sir. Next public comment, we have Ms. Rosalinda Garcia. Thank you for being here, ma'am.
Good evening, Superintendent, School Board. I'm here regarding the mask mandate. I've had my shots, and most of the time I'm not with large groups, but the children, the teachers, the staff will be, and I hope you take that action to make it a mandate that they wear their masks to protect them. There's still so much that we don't know about this virus, and now there's another variant that they call. I hate to go against the governor, but we have, all our lives, we've known to wash our hands. If we sneeze, use a Kleenex, clean the phone. The same with this virus, the mask, trying to protect ourselves. We have a seatbelt law. It's not guaranteed that it's gonna save your life, but it'll give you some protection if you have an accident. And a couple of years ago, you did that clearback policy. It was passed for safety. then I can see students. Maybe 25 will be wearing a mask and 5 won't. Will they be ridiculed? Will they, I don't know. But I think that's the best thing. I hate to go against the governor, but there's still a lot. I don't want to have to hear a child died. Let's take some action. No, we need to take action now. Thank you.
Ms. Garcia, thank you for being here tonight. That concludes our public comment for tonight. We move on to action agenda items 2.1, discussion, consideration, and possible action regarding a mask mandate for all students, employees, and visitors to all SBCISD buildings. Dr. Carmen?
Thank you, Mr. Moreno. These agenda items are on here at the request of Mr. Lopez and Dr. Ariel Cruz, and I'd like them to speak to it when they have the opportunity. But we also have our school nurse here, our district nursing coordinator, Jeanette Rodriguez, to provide some information, CDC guidelines, recommendations, orders, et cetera, just so we all kind of have a base of knowledge and we're all talking the same language. So I'd like to let her present her information, and then if those two board members want to state why they put these on here, and then discussion for the board, sir.
Thank you, Dr. Carmen. Welcome once again, ma'am.
Thank you,
The
sir.
floor is yours.
And good evening, Mr. Board President, Dr. Carmen, and board members. Let's see if we can get this started. Okay. Okay, so we are going to go over information, like Dr. Carmen said, just in regards to mask, what we are, what the current executive order is that was issued by Governor Abbott, and the information released by Cameron County Public Health today, in addition to the CDC recommendations. So currently, Governor Abbott issued an executive order that prevents any school districts from requiring students, staff, or visitors to be required to wear a mask when they're on campus. In our previous school year, we did require students and staff to wear masks when they were on campus grounds, but this order prevents us from being able to do it for this current school year. Cameron County did, the local health authority, Dr. Castillo, released this information today. I did put some of the highlights on there just in regards specifically to students, about a record increase of cases resulting in the highest level of hospitalizations for school-aged children since the onset of the pandemic. Children infected with the Delta variant of COVID-19 appear to be more capable of contributing to the spread of COVID-19 than has previously observed. And then there is other information on there that I'd be happy to provide to y'all, but it does go into detail in regards to each hospitalizations, transmission, current recommendations regarding indoor masking. So the final part that goes over the Cameron County local health order is in regards to grades pre-K through 12 and indoor masking and school transportation masking. For the Center for Disease Control, according to the CDC, when teachers, staff, and students consistently and correctly wear a mask, they protect others as well as themselves. Consistent and correct mask use is especially important indoors and in crowded settings when physical distancing cannot be maintained. We will go over the 3 recommendations the CDC has provided, which include indoor, outdoors, and during school transportation. So the CDC recommends indoor masking for all individuals aged 2 years and older, including students, teachers, staff, and visitors, regardless of vaccination status. CDC recommendation for outdoor mask use. Generally speaking, if people are outside, they don't necessarily need to wear a mask unless they're going to be in a crowded area or in continuous close contact with someone else. Fully vaccinated people might choose to wear a mask in crowded outdoor settings if they or someone in their household is immunocompromised. And then recommendation on mask use during school transportation. The CDC did release guidance that said passengers and drivers must wear a mask on public transportation. This does include school buses as well, regardless of their vaccination status. Okay, and of course, we do have some mask exemptions that the CDC goes over. Anyone under the age of 2, it is not recommended for them to wear masks. Anyone who cannot remove a mask on their own, it's not recommended for those individuals. Or someone who has respiratory conditions or respiratory complications where it would further cause difficulty with their breathing. So that information just basically goes over those specific people. This is just a very brief overview of what we should look for when we're masking. I know that I'm sure all of you have seen people who have their mask down beneath their nose, maybe have a see-through mask, all different kind of things that maybe will not fit the appropriate criteria. So these are things that when selecting an effective mask are things that we would look for. And of course, there are child-size masks that the district has provided and continues to provide for our students, as well as adult masks too. This is on here because I think it's a really good graphic that shows exactly what can happen when we do or when we do not wear a mask. So if you look at the top picture, that is showing a high risk of spread between 2 people who are not wearing masks. And so the one on the left is a COVID-19 carrier. And so you have to think, most people or some people would say, if I'm having symptoms, I would just stay at home. But that's not the case. There are asymptomatic carriers who can still transmit the illness. People who are vaccinated and maybe have mild symptoms can still transmit the virus. So a COVID-19 carrier, whether they're symptomatic or asymptomatic, can still, without either party wearing a mask, can still be at high risk of spread. For the second one, the moderately high, if the healthy person is wearing a mask, that does provide some moderate protection for them. For low risk is if the COVID carrier is masked, and then the lowest risk is if both individuals are masked. Especially considering most of our elementary age students are not able to receive the COVID vaccine yet. We, of course, would want them at the lowest risk, and that would be with everyone wearing their mask. And I know another gentleman went over the list of school districts that currently do have mask mandates in place. I just highlighted or bolded the ones that are in our area. And so those are currently the ones that are imposing mask mandates on their school district. Okay, any questions?
How many students are vaccinated where you work at? Or
I don't have the number of students
have
that
the
are vaccinated. We have done, this Friday will be our 20th COVID clinic.
Okay.
And we have administered 5,000 vaccines, but I don't know the number of actual students that are vaccinated at this time.
would you recommend for us to adopt this mandate?
Yes, sir.
Yes, okay.
I would. Any other questions?
Have we had any students that have come to school with COVID?
Yes, we have. Just since the 11th, we have had 18 students that have tested positive on campus.
And how did you all catch them?
They were identified either through having symptoms or they were close contact of someone else who was positive, and then we subsequently tested them and they were positive as well.
Are you all also checking for temperature in all the schools?
Yes, we are doing temperature screenings upon entry for staff and for students. And if we have any visitors, those are also screened.
What's our current student population right now?
We have just under 8,300 students right now.
8,300 students?
Right.
So that would be less than 1% of the kids that have come to school positive, and you all caught them and took corrective action to protect the rest of the students, along with all the other measures that the school district is doing also. Dr. Carmen, I was going to ask you, besides, I know that there's a lot that you're doing already in the school district, and I know that there's a mandate out there by the governor that says that if we were to go against the governor's actions or order, that school districts will be sued if we do pursue mandating the masks. So I was going to ask you, what other measures can you take also? Have you considered other measures such as maybe social distancing kids as well, maybe having Monday, Wednesday classes instead of Monday, Tuesday, Wednesday, so that way we can alleviate the number of students that are in schools. We have several schools that are closed also. Can we start using some of those schools and start spreading out kids so that way we can contribute to decreasing any students getting infected secondhand? Before I make a decision as to whether we make a mandate or not.
All right, so your first question, I think, was could we go Monday, Wednesday, or Monday, Wednesday, Friday instead of every day? And the answer to that is no, unless we modify our school calendar. If we were to go alternate days, I mean, there would not be enough days in the calendar year to accommodate that, unless we did it for like a month or two. But no, that would require change in our school calendar. Students have to be in class certain number of hours, 75,600 minutes throughout the school year, and we don't have an exception to that. Regarding other buildings, can you elaborate specifically which buildings you would recommend that we would open to students?
Where you have, I know that you recently moved some of the departments into the Landrum Elementary, so can Landrum be used again? Are there other buildings, other campuses, portables, anything like that that can be used at the campuses to try to alleviate some of the crowded classrooms, if we have any crowded classrooms?
We did away with a number of portables that were old, did away with Portable City, the PRC had become, I think 12 portables maybe. They were old, they were in disrepair, and we have moved our PRC and our gateway into 2 hallways at Landrum. And then the remainder is taken up with district staff. To displace that staff to gain, I don't know, 10 or 12 classrooms, I don't think would make a huge dent in the 8,300 kids we have right now. Additionally, if you're to use that building, you have to move instructional staff over. So if you open up more classrooms, to hire additional instructional staff, I don't think that's the most feasible option. But we could open up some rooms at Landrum. I just don't know that it's, I think it would be ill-advised.
I think that earlier it was mentioned by somebody in the audience, they said there shouldn't be a cost to taking care of our kids and making sure that they're safe. So I think I agree with that statement that was made, and if we could do that, besides us discussing if we're gonna have the mandate or not, that I would recommend that for the school district. I know that it can be more costly, it can be more expensive. However, you do have ESSER funds and you have other funds. And you all would need to come up with a plan to try to see what we can do to make our classrooms smaller also, so that way we can social distance our kids. It's better to be safe than sorry.
If I may, I'd like to make a couple of comments, and I had a discussion, not a discussion, a conversation with Dr. Carmen and our attorney earlier today. And we realize that these rules or these policies are changing as a snap of a finger. I mean, one day from 1 hour to the next. Mm-hmm. And so one of the slides that you alluded to, ma'am, actually it was the CC Health Authority asking for pre-K through 12 masking be recommended. I think it was about the second or third slide. Oh, right there, right there. It says the Cameron County Health Authority hereby imposes the following health and safety measures on all public and non-parochial private schools offering instruction to students in any grades pre-K through 12 as follows. The universal indoor masking. However, there's that little arrow there, pending the outcome of the legal challenges regarding mask mandates. Now, you know, number one, in speaking to Dr. Carmen, I wanted to know what the percentage basically was as far as our students and staff members wearing masks. And I'm not targeting you, but you're still there, so I mean, just
No,
so
that's
so you
okay.
know about the conversation. In the conversation that I had with Dr. Carmen, basically, he stated that roughly, probably about 99% of our staff members and our students are already utilizing masks. So that's pretty good. So are we doing what we need to be doing for the majority of, I mean, not 100%, but 99% is quite a big percentage. And so, yes, and then we also need to configure in those that you know, may have some type of situation, medical situations to where it impedes them from having the mask. But once again, I state that 99% is a good. It doesn't encompass 100%. My other comment that I'd like to make, and I also heard this in public comment today, making reference to the governor's mandate, okay? And so my concern would be, right now, all we know, nothing is clear. It's not set in stone, nothing is clear, but we do know that Governor Abbott is coming back at these school districts that have either filed lawsuit or that are enforcing their own guidelines. Once again, I agree, in the best interest of students, in the best interest of staff, in the best interest of their communities. However, right now, as the last I read, and I mean, I'm privy to a little bit of information, not as much as the superintendents are, but as a campus administrator, I'm privy to some of these reports that come out. And basically, one thing that I noted is that school districts that have either filed lawsuits or, and correct me if I'm wrong, Dr. Carmen, but there's a fine possibly of $1,000. And in that conversation with Dr. Carmen, we don't know what that fine is. Is it $1,000 a day? Is it $1,000 one-time deal? You know, if it was a $1,000 fine, you know what? Well, no biggie, okay? But we don't know that. And again, as fast as these things are changing, as fast as these policies are changing, you know, what risk are we running? Are we going to run a risk of where the governor comes back and attacks all these schools that have instilled these mandates, and then maybe remove state funding for certain school projects and stuff? And so that's of concern. Now, again, with all respect, I'm an educator myself. I'm working in a campus with 5th through 8th grade students, where the majority of my students are not vaccinated. You know, and are we at risk? We're all at risk. I could be a carrier. I'm vaccinated, but I can still be a carrier. But we also are doing, at this point, as of today when I left, we are also, we haven't even started school yet. However, our plan is to highly recommend the utilization of masks. And so I was having this conversation with a couple of my colleagues here before, well, with Mr. Lopez, and you know, I don't think that we're being premature. I think we're exercising caution as to what our recommendations are, but I also would caution our board in reference to making a rash decision that might be overturned regardless by the end of the week. And so I know that—
Mr. Moreno, if I may interrupt to go with what you're saying right now. It says, no government in Texas may impose a mask mandate. That's by the Attorney General Ken Paxton. It says, yet too many local officials continue to violate this law. This was just put out in the public a few hours ago. It says, I will sue every single local entity and local official who does. And if they continue to disobey, I will pursue additional legal sanctions. So I agree with you, Mr. Moreno, what you're saying. We can't make rash decisions right now. I think we need to think and weigh our options and then decide what we need to do with that.
No, I just want to continue for maybe 2 more minutes. We also, in partnership with Mr. Weller, Dr. Carmen asked Mr. Weller to come up with a resolution and basically mandating the use of masks pending the outcomes of this litigation that's ongoing that may be resolved within a couple of days, maybe by the end of the week, and we would hope. But ultimately, my concern, and where now I'm going to go on the flip side where I'm really scared, is that basically the Texas Supreme Court may not side on the side of schools and support the decision of the governor, and then we're back to square one. So again, it's a double-edged sword, but I personal opinion, I would err on the side of caution and protect our school district from being attacked later by some political retaliation in reference to us losing any type of funding, and we don't know. We don't know. So that's my 2 cents, and I welcome anybody else as well, because we do have 2 board members that are in the medical field that I'm sure have plenty to say as well.
Yeah, I got a few things to say. I respect everybody's opinion, and it's very obvious that the CDC and the governor don't see eye to eye, but this is not something new. This has been going on for almost a year now, and nobody seems to be on the same page. But I'll tell you what, I'm a parent first, and I got a child that comes to this school district, and yes, I'm privy to a lot of information too on the healthcare side, just as Dr. Cruz is as well. And most of the pediatric beds in the valley, in this area here, are pretty much taken up. So that's pretty serious. Yes, I know our school district's done a tremendous job. I mean, I'm not gonna say fortunate enough, but, I was here on the onset of COVID, and we did a lot of great things to mitigate, some more of these tragic situations during this crisis time. But the reason why I put this on the agenda, because it's not gonna get any better anytime soon, folks. It's gonna get worse. So we can sit here and just read the political situation on Governor Abbott that sits in Austin and stuff like that. But you know what? Here we're in the Lower Grand Valley. It's a very hot zone, and it's very obviously going to be another hot zone again. So once again, I've always said this since I came on the board. I'm not going to put a price tag on anybody's life, especially kids and our staff too. To be honest with you, so. I mean, if our kids are not healthy and our staff is not healthy, then our kids are not getting educated. And you know what? We're going to be going in circles. So in my opinion, I think we need to be very aggressive. I think we need to be extremely proactive. And it's very obvious that a lot of other schools are thinking the same way. That's the reason why I decided to put this on there, because honestly, I'm extremely worried about this whole situation. So I think we need to take it extremely serious. Thank you.
I agree with Mr. Lopez. A month ago, we thought this was nearing the end. We saw the light at the end of the tunnel. We thought, hey, let's highly recommend masks. Let's leave it up to the people. Like this is coming to an end. We're doing a good job. People are vaccinated. And then all of a sudden, it just comes roaring back. And as a healthcare professional, it's overwhelming to me. And I'm in the outpatient setting. I get them after they get out of the hospital. I get them when they've gone to the clinic and they've taken the COVID test. I don't get them in the hospital. I can imagine how overwhelmed the staff at the hospital is. And I talked to my friend who's a physician, an internal medicine physician at Valley Baptist. And he told me, he goes, it's getting bad again. We're at 90 to 100 COVID patients in all over the hospital. And I understand Ms. Lopez's point of view. Let's spread the kids out, let's social distance, let's not require masks. But as it is, we don't have the staff to handle the kids we have in the campuses they're in right now. And our mission statement says to provide a premier education for all students through a positive and safe learning environment. And if we can enact a mandate just to make our environment safe, like I don't have kids right now. Mr. Lopez, Mr. Corona have kids in the school district. You have grandkids in the school district. I mean, if it's a small piece of fabric, a small mask that'll keep them safe from the hospital, if you've ever had to counsel a parent when their kids spent a stint in the hospital, these kids are coming out with medications that I see for adults who have heart attacks. And it's the same medications for multi-inflammatory organ disease secondary to COVID. So it's not, I mean, I think a slide before this, it says that they don't think the governor's executive order is applicable anymore due to the rise in the Delta variant. And I agree. We need to do what we can for our students and our staff. Because here in the Valley, I was looking at the Texas Department of Health and Human Services website, and it goes through the vulnerabilities of each county. And in Cameron County, we have the highest vulnerability for all of our citizens. So if we can protect our students and we can protect the families that they go home to, let's do it.
Ma'am, I want to share something with you. That slide this presentation here was extremely phenomenal, because that just puts into perspective what's going on out there. People can take our words, day in and day out, but when you see what's going on in the struggles between government and the CDC and so on, and healthcare professionals, I mean, it's pretty disturbing, to say the least. So to sit on one side or another, I mean, in healthcare, you always want to go on the side of precaution and, of course, to mitigate any additional risks. So that was the reason why I did this, because I've seen it firsthand, just like Dr. Cruz as well, and I'm sure all of us have been impacted one way or another. But we are seeing a huge increase on the pediatric population side. And you know, I think, you know, with this whole variance and all this other stuff, I really feel that we need to, just go above and beyond and put this mandate into place. You're a healthcare professional, the leader of this organization, and you agree with it, right? So why? Because you're in the front lines. You see what's going on, and you see all the data and all that good stuff. So, you know, it's one of those things. So, I just hope this board, follows and wanting to protect all our staff and all our kids. Thank you.
One thing, I'm sorry.
Go ahead.
In regards to there was a TEA public health guidance put out on August 5th. And so that puts a different, I guess, kind of spin on things and I feel like why there seems to be an urgency for the mask mandate, because in our previous school year, we were allowed to require students who were close contact to quarantine. This year, the students have the option to quarantine or not quarantine. So 70.1% of the students that we tested out of the 17 that I told you, those were students that were close contacts and then now have the potential to be spreading COVID to other people. So having the mask on for those students would be just one additional measure to protect all other students and our staff members as well.
And were those students wearing a mask?
I'm not sure if those students, I can find out for you on those particular students. I was told specifically on about 5 that they were not.
So, ma'am, you said, and I'm aware that they have the option, their close contacts and parents have the option of sending them to school regardless. They're not contracted, they haven't contracted the virus. So out of those that you're mentioning, did they come back that you know of?
Yes. So the 17 that we've had test positive, the 18 that we've had test positive on campus, 70% of those were close contacts that then did become positive and were tested at school positive.
And Dr. Carmen, can you answer this next question? Do we have this in place to where, I know districts aren't obligated anymore to do the contact tracing, but here at SBCI's we are?
Yes, sir, we are.
So, yeah, I just want to I'm clear on this. So if a child comes out positive and whoever's around him, they don't need to get tested? I mean, you just notify saying they were in close contact, but they still don't need to get tested?
Correct. We strongly recommend that, of course, anyone who's identified as a close contact, that they either do the 7-day or 10-day quarantine. But with the new TEA guidance that was released, it is quarantine for students is optional. Excuse me.
Wow. Well, what I did want to say was, I understand your all's concern as far as going against the governor, but if you listened to the news last night, they said that the majority of the people in the hospital right now are children, and that's what worries me. I have a son who's also a student, and I have a wife who works with the school district, is around children all the time. So that does scare me. You know, I just think we should all really consider the mask.
And I've been keeping up with those numbers also, but a lot of those numbers are also the immigrant kids making a long journey, 6,000 miles long, and they're getting hospitalized because they were without treatment for a long time. So it's not necessarily only our community kids, it's a combination of the 2 different groups of kids as well. And it is a concern. We're not going to dismiss any parents' concerns, and it's a concern all over the U.S., all over the world, you know. And the school district is doing as best as they can. However, I'm going to make a motion to go ahead and place this item table this item to move on to the next to the next item on the agenda, so that we can vote on the resolution.
So, Dr. Carmen, if I may, we have a motion on the floor, but before I entertain that motion, we've got 2 motions, basically. One was the one that we're discussing now, to discuss possible action on this mandate, and then the other one, following 2.2, says it's the same thing except with the resolution. Am I correct? So, correct?
Yes, sir, that's correct.
Okay, so if since there's a motion on the floor, do I have a second? Ms. Lopez made a motion that we table or that we
Table 2.1 so we can vote on 2.2.
table 2.1 to vote for 2.2 and start, have an action item on 2.2. So do I have a second?
I'll second that.
Okay, we have a motion by Ms. Lopez to table item 2.1, seconded by Oscar Lopez. All those in favor?
Can I have a
Oscar
question?
Medrano, sorry.
Can I ask a question now?
Yes, sir.
Before we vote?
Yes.
So 2.2 and 2.1, total different? or-
They're exactly the same thing, except for the 2.2 will be to recommend the masks, the mandated masks, with contingent of the resolution and whatever stated on the resolution.
And Mr. Weller, if I may ask you a question, we have the resolution in place. Do you foresee the Supreme Court taking months before now to make a decision within a few days that the schools got started? By Friday, people were filing lawsuits against the governor. Sunday evening, the governor put out a statement. The Supreme Court of Texas, which is the highest court in Texas, put out a statement. And today, we get another statement. How soon do you see the Supreme Court taking action on this?
Well, you have two different sets of lawsuits that are pending right now. The first one is the one that was filed by Dallas, involving Dallas County and Bexar County. That matter proceeded very quickly to obtain initial guidance from the Texas Supreme Court. The order that was adopted in Dallas County was adopted on Wednesday. By Friday afternoon, there had already been a lawsuit filed over it from the governor's office through the AG. You had a ruling out of the Dallas Court of Appeals, and then you had the Texas Supreme Court issuing a ruling regarding the temporary restraining order by Sunday. So, in other words, within 5 days, you had guidance from the Texas Supreme Court as to what they were going to do, at least with the TRO. Now that injunction, now the whole lawsuit will continue to proceed. It's just that the injunction prohibiting the governor from enforcing GA 38 was stayed per the Supreme Court. Now the other matter that's pending right now is one that's originated in Travis County. It is a lawsuit that is more focused on the arguments advanced by the school districts themselves. That matter is at the beginning of the process. The Travis County judge just signed her orders restraining the governor for the time being from enforcing GA 38 around the state. It's hard to tell exactly how quickly that will proceed, but I would expect it's going to follow a similar path in terms of timing as the matter that just concluded, which took 5 days.
Okay, I have a question. So 2.1 means mask mandate immediately. 2.2 means mask mandate contingent on the litigation.
And with the resolution.
No, ma'am. If I can interject, I think 2.1 is an action item that just talks about the mask mandate generally. Item 2.2 is the resolution.
Oh, okay, so 2.1.
So if the board wished to take other action pursuant to this topic, I believe you could do so under item 2.1. If you want to consider the resolution on whatever terms the board deems appropriate, that would occur under item 2.2.
Mr. Weller, I'm reading discussion, consideration of possible action on resolution regarding a mask mandate for all students, employees, and visitors to all SBCISD buildings. Is that correct?
Yes, that's how 2. And I didn't prepare this agenda language, but I can read it and I can tell you that under item 2.1, it's an action item pertaining to a mask mandate. That could be any variety of action. Item 2.2 is consideration of the mask mandate itself.
Okay, so at this point, Mr. Weller, I do have a motion on the floor by Janie Lopez and seconded by Oscar Medrano. So that is a standing motion. Do you agree with that?
Yes.
Okay, so at this point, I'm going to go ahead and put item 2.1 up for a vote. All those in favor with us tabling item 2.1, raise your right hand. Okay, all those opposed? All righty. Motion carries 4-3. Moving on to 2.2, discussion, consideration, and possible action on resolution regarding a mask mandate for all students, employees, and visitors to all SBCISD buildings. Now, Mr. Weller or Dr. Carmen, and myself, but I'll turn it over to either one of you two gentlemen. You both have a little bit more, you guys know a little bit more about this resolution, so can you inform the board as to what it's all about and what it states?
I can give a brief overview, and if Mr. Weller wants to elaborate, happy to let him jump in. Really the meat of this, I think, is on page 2, under where it says now, therefore be it resolved. There are 5 statements listed there. The first one is that all students, staff, and visitors while indoors on SBCISD property and while riding SBCISD buses must wear face masks covering the nose and mouth. 2, masks are not required while eating or at other times specifically deemed reasonably appropriate by campus principal or building administrator related to health and safety. 3, individuals with medical needs or disabilities that prohibit the wearing of masks upon acceptable verification are excused from these requirements. 4, there's a date you can fill in for when this resolution would take effect. 5, consistent with limitations and conditions set forth in this resolution, the board authorizes the superintendent to advise all students, staff, visitors, and parents of the existence and application of this resolution through any appropriate measures. And then there's a sentence or a paragraph there that talks about the applicability of this resolution being contingent upon the existence or continued existence of an order or orders from court or courts of competent jurisdiction that enjoin, restrain, and or prevent the Texas Governor's Office and any of its agents from enforcing those portions of Executive Order GA38 that purport to prevent school districts or SBCISD from imposing a COVID-19 mask mandate within school buildings or facilities, and or is contingent on the issuance of guidance from the Texas Supreme Court or other courts of competent jurisdiction, providing that those same provisions of GA38 may not be enforced against school districts. During periods in which the above noted portions of GA38 are not enjoined, restrained, prevented, or otherwise deemed invalid, this resolution shall not be in effect. So essentially, in a nutshell, Mr. Weller, you can correct me if I'm wrong, but what we're saying is those 5 statements would hold true only as long as the courts give us the authority to do so, stating that Governor Abbott's GA38 order is not either enforceable, it's prevented, or otherwise. Is that pretty close?
Yes, sir, that is what it says. And the terms of the mask mandate are similar substantively to what other school districts have done in tackling the same subject. The only part of it that really is added are the parts that are unique to Cameron County, obviously the notations as to the announcements from the county and the county health authority. And then the paragraph at the bottom is it basically states that as long as the district has legal cover in one way, shape, or form from enforcement of the governor's order against you all, that the resolution would remain in place. And for the record, this was prepared as something for the board to give consideration to. It can be a starting point. It can be the resolution you adopt. It's completely up to the board. However this board elects to go is how we will go. And whatever decisions you make as your legal counsel, we will represent you.
Mr. Weller, I have a question on number 4 out of those 5 items. The resolution will take effect on August blank 2021. So if this agenda item were to be approved as written with the resolution, contingent on all these things that's stated in the resolution, and these nothing is resolved within the near future, say it takes 2 weeks, so we will not have to come back to a board meeting. The superintendent will be able to, as of that date that this becomes resolved, we can actually enforce it, and he can make it public to not only the community, but teachers, students, staff members, correct?
That is correct. Some of the other school districts that have been adopting mask mandates we're not doing so with making them effective immediately. Some of them, I believe, were being triggered by when they were starting school. Some of them were giving a few days for folks to make sure that they were ready to comply with it. So, I left the date blank as to when it would go into effect. It can be whatever the date the board chooses.
Another point that I wanted to make that's written on here as well, and it's, do all of you have the resolution? Paragraph number 1, 2, 3, 4, 5, 6, that really raised an eyebrow, and I'm gonna read it, so please forgive me. It says, whereas on August 16th, 2021, the Cameron County Local Health Authority, pursuant to Section 81.082 of the Texas Health and Safety Code and Title 25, Section 97.6H of the Texas Administrative Code, has entered an order regarding all public school systems in Cameron County, Texas, and ordering them to implement a policy to follow the Centers for Disease Control and Prevention recommendations for universal indoor masking and require all students aged 2 and older, staff, teachers, and visitors to K-12 schools, regardless of vaccination status, to wear a face mask indoors as soon as they, and I'm going to quote, determine it is legally permissible to do so. With that said, I'm going to, I'm not trying to throw anybody under the bus, but I want to, if with your permission, I don't think that we said anything that was out of the ordinary, but in my conversation with Dr. Carmen today as well, I look to him as the leader of the district, and I posed a question, and I'm not going to pose it the way I did necessarily do to him, but I'm going to kind of like rephrase it. But basically, I said, okay, you're the leader of the district, Dr. Carmen. We have 2 choices. Basically, one, mandate masks right now, or we wait until this litigation, it seems to, it could be 2 days or 3 days, or it can be by the end of the evening today. So basically the question I posed to him, I said, and he agreed, if we change this policy today, we will be breaking the law. And basically, in not so many words, and again, Dr. Carmen, please interject. Dr. Carmen says, I would never, in my position, ask the board to do anything that is breaking the law. And so therefore, he also is looking out in the best interest of the district and our kids and our teachers. But I would venture to say, and please, Dr. Carmen, by all means, elaborate on that. Dr. Carmen agreed with the fact that we perhaps need to wait for this resolution and do it the right way without having any other retaliation or any type of bad things happening to our school district. So, Dr. Carmen, if you want to elaborate, please do so.
Yes, sir. And that's exactly right. I would never make a recommendation to a board to do anything that was not legal. But as I'm understanding this, and Mr. Weller, I'm going to point to you here in a second. As I'm understanding this right now, based on the Travis County action, this board has the authority to effect a mask mandate, effective immediately or effective in the morning. And based on the language of this resolution, should that change in 3 days, 4 days, 6 days, we would, in accordance with how this resolution is written, we would then lift the mask mandate at that time without having to have a subsequent board meeting. Is that correct?
Yes, sir, that's correct. And again, as a starting point for discussions for the board to have an opportunity to take whatever action it wants to, the resolution is flexible. It states that you will have a resolution in place. You will have a mask mandate in place for so long as you have legal protection from a court of competent jurisdiction, giving you protection from the governor's executive. So if the order that's come out of Travis County remains for 2 weeks, and then the Supreme Court turns it over, you would have a resolution in effect for 2 weeks. If it stays in effect for 2 days, it would go as such. So by its terms, it would operate during periods of time in which the courts have told the governor that his order cannot be enforced.
Okay, so just for the record, Mr. Weller, so everybody understands what's happening right here, right in front of us. So first of all, as far as breaking the law, so on and so forth, at the end of the day, we're protecting kids' lives here, so I don't think it's breaking the law. We're just standing up for what's right for our kids here in this little community of San Benito. So that being said, it's very obvious a lot of people did the same thing that we're doing here. So to go above and beyond and to say that we're breaking the law and doing all kinds of other stuff like that, at the end of the day, we're trying to save people's lives. Okay, so I just want everybody to understand here that we're going based on what Governor Abbott said. We're not going to move on this until Governor Abbott says it's okay for us to put this into place. So I totally disagree with it. I think you know, we're creating, you know, in our little community here, San Luis CISD in this school district, I think we're creating, you know, a major mistake. And I'm very upset about it and very appalled by the decision. Thank you.
I know that Mr. Lopez mentioned that a lot of other schools are doing this, a lot of other districts. However, we only have 4 districts that you all mentioned out of the 33 public school districts that are in the Rio Grande Valley, and that's not including charter schools and other type of schools that are out there for students. So it's only about 4 districts that are doing this. The only one near us is the Brownsville ISD. And I am going to make a motion at this time to mandate masks as written on the resolution.
So we have a motion on the floor to, regarding the mask mandate for all students, employees, and visitors. To accept what motion to mandate mask as written in the resolution and basically go with the resolution. Okay, do I have a second?
We don't have a date on the resolution.
No, we don't. That's open.
Well, yeah, because Governor
We need
Abbott.
to decide on.
No, because Governor Abbott hasn't approved it yet. That's why.
No.
It's pending
Look,
the items on the resolution. There's
Hold
5
on.
items on there, and once those items are met, then they'll put a date on it.
Okay, but what Dr. Harmon and Mr. Weller just said, if we approve the resolution to be effective tomorrow morning, August 17th, it'll be in effect until the Supreme Court shuts it down. Whether that's 2 days or 2 weeks, we either have a 2-day mask mandate or a 2-week mask mandate.
Yes, ma'am, that's correct.
That is correct. That is how it would operate, yes.
Thank you for that clarification. So, Ms. Lopez, what can you want to clarify your motion, or is it as is? There is not a date, so basically, the way you're saying, the way you stated the motion, it would basically, the way I understand it is we're not accepting this mask mandate until basically things change as far as the litigation on this. But if we stand to make the motion as written and say it effective today's date, then this resolution of having a mask mandate will go into effect immediately, and we will have a mask mandate starting tomorrow, okay? So which is the way that we want to, or that you are recommending?
My recommendation is go with the mask mandate based on the litigations and how they come out. And if they do enforce litigations that say that we can't enforce the mask mandate, then we'll do it at that point.
Okay, so my understanding is you have a motion on the floor to accept the resolution as is, but it will not go into effect until we hear further, with the superintendent being able to put this resolution in effect as soon as this litigation is over. Basically, that's the way it's written. So do I have a second? I'll second the motion. All those in favor? Again, this is the putting into effect the resolution pending final litigation that may come in a couple of days or at the end of the week. So we have a motion by Ms. Janey and a second by Mr. Moreno. All those in favor, raise your right hand. 2. Okay, all those opposed? 1, 2, 3, 4, 5. Okay, motion fails. Okay, the agenda item is still on the table, so anybody may follow up.
Yes,
I
ma'am.
will make,
Go ahead.
I will make a motion that the resolution become effective tomorrow morning, August 17th, 2021, as is written on the resolution.
Do I have a second?
Second.
Okay, we have a motion by Ariel Cruz and a second by Rudy Corona. All those in favor, raise your right hand. I'll go ahead and move 1, 2, 3, 4, 5, 6. Okay, all those opposed, raise your right hand. Any abstentions? Are you going to abstain? Okay, so motion carries 6 with 1 abstention. All right, moving on. That's all we have as far as General business, adjournment. Do I have a motion to adjourn? Okay, Oscar Medrano motions to adjourn. Do I have a second? Second by Orlando Lopez. All those in favor? Raise your right hand. Okay, 7-0. Meeting adjourned.